Hello, my name is Pramod Gaur and I am making this video for my QMAP practicum assignment. So if I'm administering a patient, I will always follow the doctor's report which is in the MAR. I will always wash my hand. So to wash my hand, I have to wash my hands for like 60 to 80 seconds, and I will ensure that the soap and during the hand washing process, my under the nails and between the fingers and top and back of the palm all are covered, are washed properly. And when administering a patient, I will remember the I will always have to keep in mind the seven rights, which is uh, the the right client, the right time, right medication, right dose, right route, right documentation, and right to refuse. And every time I'm administering a patient, say I have to wear my gloves, and say like if I'm administering a oral medication, I will wear I will wear my gloves all the time. I will make the patient sit up straight on a chair, and before the medication is given to the patient, I will give a little bit water before he intakes the medication, and I will stay there till the medicine has been consumed. And once it's done, I will take off my gloves, wash my hand, and I will document in the MAR. Say if I'm administering a liquid medication, I will follow what is the follow with the doctor's order as per the MAR, and I will make the patient sit up straight. I will wash my hand, wear my gloves, and I'll be very careful when taking the liquid medication. The portion has to be exactly as per the doctor's order. So say like if this is the medicine cup, I will put the cup on a flat surface. Let's say this is a tabletop, and then I will parallel my eyes while pouring the medicine so that I get the exact amount. So this is the process I'm going to do. Just go down, bend over a little bit, and see that the portion is right. This will be for the medic liquid medication, and and I'll stay there until the medicine is consumed. And once it's done, I will take off my gloves, wash my hand, and I will do the documentation. And then I will keep in a few things in mind while pouring the liquid medication, that the bottle top needs to be cleaned properly and put back the cap, and the label of the bottle should be facing my palm, so if there's any drips, it's not spoiling the label side of the bottle. The other is if I'm administering a sublingual medication, which means the medicine has to be kept under the tongue. So I will make the patient sit up straight. I will wash my hand and wear a glove, and I will check with the MAR. Well, I will check with the MAR all the time, at least 3 times, to ensure that I have the right amount of medicine, the right patient, and the right time. So I will keep on checking with the MAR at least 3 times for every patient. So with the sublingual medication, I'll be wash my hand, I'll wear the gloves, and I will make the patient sit up straight, and I will inform the patient that the medicine uh, it cannot be chewed or swallowed. The medicine has to stay under the tongue, and it is going to dissolve by itself, so it might take a little while, and I will stay there until the medicine is completely dissolved. So That's about sublingual. If I'm administering, say, ear drop, so I will wash my hand, wear my gloves, and I'll make the patient sit up straight, or the patient can be laid down as well, but the most preferred position is sit up straight. And I will follow the instruction on the MAR by the doctor, and say, for example, if the doctor has ordered that the ear drop has to go in both the ears, right and the left, so I have to follow one standard procedure, which is like if it's an adult or a child. So if the patient is an adult, I have to uh, pull up and down his ears, and if the patient is a child, I have to pull down and back, and then pour the medication in the other ear. If there is some outflow, or if there is some liquid is coming out, then I just have to clean it up with the cotton bud or tissue paper. And once this is done, I will wash my hand, take out my gloves, wash my hand, and I will do the documentation. The documentation has always to be done after the medication is given to the patient, all the time, no matter what kind of medication. Is it a liquid, or is it a oral or sublingual? Documentation always after. So if I'm administering a eye drop, I will make the patient sit up straight. I'm going to wash my hand, wear gloves, and see what is the doctor's order in the MAR. And while pouring the liquid in the eye, I will say, like, pull down this way, and then once there is a cup formation, the medicine drops has to go in there, and I will not drop it on top of the eyeball. The medicine has to go in there. And once this is done, and if there is some liquid which is flowing down, I will clean it up with the cotton bud or paper tissue, and I'll take off my gloves, wash my hand, and do the documentation. So if I am monitoring a topical lotion or a cream, I will check the MAR for the doctor's direction, and I will wash my hand, wear my gloves, and say if it is a nasal drop, and if the doctor has ordered to put the nasal drop on both the nostrils, right and the left. So before I drop the drop, I will tell the patient that at the count of 3 he needs to inhale. So once he inhales, the same time I will drop the medicine in his nose. So say, like, for example, if I want to drop the medicine in his right nostril, I will close his left nostril, and then me and the patient will count. Okay, I will count, and and he needs to inhale. So it will be like 1, 2, 3, inhale, and at the same time I will put the nasal drop. And if I'm administering a dermal patch, I will check the MAR for the doctor's order. I will wash my hand and wear gloves. And if the doctor has ordered that the patch needs to go on the, say, like, the right side of the shoulder up here, so if there is a patch already there from the other day, I will take out the patch, clean the surface, clean the area, and with the soap and water, and I will make sure that there is no medicine or any kind of thing left from the patch from the other day, and then I will put the new patch. So once the new patch is done over there, I will put the date and the time on the patch, and I will take off my gloves, wash my hands, and I will make a note. I will document it down in the MAR as well, the time and the date, and whatever is documentation has to be done. Say, and if I'm administering a day patch, day pack, say like that day pack gonna look something like this, like a small packet. So all the medicine what will be inside the pack, I will put a label on the top, and I will write down the name of the patient, the name of the medicine, and the date and the time, and how the medicine has to be consumed. All the information will be on top of the patch, and then once this is done, I will make I will do the same. I will document the same on the MAR. If I'm administering suppositories, so there are two kinds of suppositories, rectal and vaginal. So I have to take some special care and extra care and extra attention when doing this kind of medication. I will always have one staff with me, and I will have to talk and inform to the patient while the process is going on. I have to keep the patient updated. uh, so if it is a rectal insertion, I will wash my hand, wear my gloves, and follow what is the doc, doctor's order. And if the patient say like is lying on the bed on his left side, then with my right hand close to the area, close to the insertion area, I will put my right hand close to it, and with my left hand I will do the insertion. So but just while doing this, I will inform the patient that I'm going to insert the medication, and it should be insertion should be around 2 inches. And if I'm and after this I will take off my gloves, wash my hand, and I will do the documentation. And if I am administering a vaginal uh, insertion, the patient will be lying on the bed facing up straight, and the legs will be in a frog leg position with the knees slightly bent. And I will talk to the patient, and I will inform the patient about the process. And then while doing the insertion, I will just inform the patient that I'm going to insert the medicine, so the patient is aware. Well, that is for vaginal suppositories. Okay, I think. All right, thank you.